Good morning, medicals. Today, myself, Dr. G.R. Patel, Professor of Surgery, is going to talk about code of conduct and professional ethics, which is very important in these days, extremely important. There are so many litigations, so many complaints against doctors misbehaving with the patient and maltreating the patient like that. But what is the cause of all these problems? Litigation has markedly increased against doctors. So let us learn about the code of conduct and the ethics to be maintained by the medical personnel, which is very important. So we will be talking about one by one about these ethics. Interaction with the students. This will include the one-to-one talk with the students. What do you want to achieve after all? Students want to become a good doctor, a renowned physician or clinician in the society, a responsible doctor. That is the aim, so that he is earning his money. That's okay, but at the same time, he is treating the patient. His main aim is to treat the patient, to cure the patient. What is the goal? What is your goal about the students want to be a super consultant or whose diagnosis is never a failure, who is always worried about the patient? How to remember and recollect the knowledge. It is a memorization of the textbook or memorization what he has learned from his teacher is extremely important. Always be serious to your subject. Do not take the matter casually. Adolf Hitler was sleeping when SOS when the British army attacked his uh, his army and destroyed all the things. At that time, Britain, the Hitler's army was not given the order in time. That is the reason he lost to British. And the SOS sent from the Titanic tragedy was not received because the person who was supposed to receive the message or SOS was sleeping. Patient is your God. You need not garland the patient. You need not worship the patient. But you must show enough respect to the patient. How do you look at the death of the patient? That is a philosophical, spiritual subject which we will discuss if time permits or in the way we like. Professionalism, medical ethics, and documentation. It is personal experiences. My study up to matriculation, then Patwa magazine. I received Patwa magazine because I was a rank holder. Reading till late night and natural sleep. Do not use alarm clock. I do not prefer using alarm clock to get up at 3 o'clock or 4 o'clock, half sleep, half drowsy, and half alert. That is not going to serve the purpose. Seeing the patient first, then investigation. Nowadays, there is a trend that before seeing the patient, you advise the investigation. Here, injury patient, when the resident talk to the professor, he says, "Do CT first and then talk to me." No, that is not the solution. You must see the patient. It makes a lot of difference when you directly see the patient. It gives you idea which investigations are essential and which are not essential. So always keep in mind that you see the patient first. It will create some rapport with the patient and will give you definitely some additional signs which you can't see on photograph. Self-discipline, self-discipline is very important. Be in time, punctual. Your own supervisor, devoted to your duty. Personality development. If you can't look after yourself, you can't look after others patient. You must be well dressed. Do not put on full sleeves t-shirts like reinforcement is not recommended because the sleeve can carry the infection from the ward to your residence. You must put an apron while on duty. It is an identity of the doctors to put on an apron, and it gives a sober look and divine personality, I would say. You must avoid fashion. Nail polish and lipsticks are not advocated by the clinician. Finger rings and other ornaments must be avoided. Put on shoes without shoelaces. No chappals, no slippers, so that you do not have to bend down to remove your slippers or chappals and carry the infection in the ward. Hairs must be tied down. Girls or nurses must put on armor like a Florence Nightingale. No gutka, no tobacco, no punching. That gets a very bad impression to patients and medical students. Mobile phones must be avoided while examining the patient. Do not respond to mobile calls halfway through while talking to a patient. Patient will feel you are not interested in his or her problems. Do not use your mobile phone while doing operations. Your concentration will be broken. OPD discipline must be maintained. Always call the patient by name, not by disease. Welcome gesture. Ao, beso. That gives a lot of confidence to the patient. Do not smoke. Do not play TV or radio in OPD or consultation office. Let the patient talk without any inhibition. Provide privacy. Do not lose your temper. Be sober, soft-spoken, empathic to your patient. Reveal the diagnosis after confirmation only. Always examine the female patient in presence of a nurse or a female attendant or patients. Examine one patient at a time. Do not examine the patients in group. Example, intensive stand-up patients with diarrhea. So 5 patients will stand up and they will give loperamide. 5 patients will stand up and give metronidazole. They will collectively be given 7 patients headache, 10 patients, etc. That should not be done. Do not avoid the patient. Handle the patient on its merit. Always keep yourself free for the next emergency. Always read the X-ray on view boxes only. Half of the abnormal findings will be missed if you do not read the X-ray on view box. Do not use abbreviations. Use left. L should be avoided and R should be avoided for right. Wrong side has been operated and amputated due to the mistake by writing R and L. AI means abbreviation should not be used. AI means aortic incompetence or regurgitation. MI means myocardial infarction or mitral incompetence. Retinoblastoma, say a girl, 10 or 12 years old girl was having retinoblastoma, say in the right eye, and she was operated upon, and the left eye, which was normal, was removed by the surgeon. Now, what punishment should be given to the surgeon? Can you imagine? These are the unpardonable mistakes. MRI, wrong labeling. Can you tell me was done on the wrong side? Patient safety checklist must be done as per the m.b.b.s standard. Patient name, age, sex, address, etc. must be checked and confirmed. Always see the patient first, then interpret the investigation. Always follow the established chronology while treating the patient. If in doubt, call your senior at middle of the night. Do not sit on the patient's cot. Sit on the stool by the side of the cot. Operation theatre discipline. Always follow the established rules for OT. Take universal precautions. Always confirm the procedure to be done. Always be in harmony with the anesthetist. Do not clash with anesthetist. Opt for pre-procedure counseling. Take anesthetist permission for starting operations. Injections discipline, do not write IM or IV. Write intramuscular or intravenous. Give injectables with your own hands. Give injection to one patient at one time, turn by turn. Do not prepare many injections in the tray and then go on injecting one after another. The patient may receive wrong injection. Do not treat blood relatives at your own. You are likely to be biased. Let your own relatives be treated by third-party consultants. Always explain to the patient about the procedure to be performed before taking the consent of the patient in patient's own language. Dissertation topic to be submitted within 30 days of join. Take a written permission of ethical committee. No plagiarism. Reference Vancouver in Vancouver style. Follow the DNB guideline. Spiritual, what is that? Perform yoga. Include in your routine timetable. Develop super fast thinking. Memorization is the only way to remember the vast literature. Always remember the oath of Hippocrates or Susuta. Do not run for name, fame, or money. They will come to you automatically if you are devoted to your duties. Knowledge is power. Put down or abolish your egos. Admit your mistakes. Accept your mistakes. Patient is supreme. Doctors are the worst patients. There is no shortcut in patient's treatment. There is nothing like short case or long case. The classification is for convenience. Do not try to cheat the patient. Example 2 appendix. Appendix can recur. Do not fight with patient for bill. Personal experience. Appendix. Blue structure. The surgeon identified the appendix blue looking structure and it was iliac vein. It was torn and the patient was lost. In children, appendicitis can recur. Intracutaneous fistula in a female patient in a poor condition in a village. There was strangulated femoral hernia. The patient ignorantly stabbed the hernia, strangulated and created intracutaneous fistula. Patient survived and came to the surgeon after 20 days or so in a surgical camp. Subhepatic appendix, young girl relative of Professor M.T. Burhole, doing Burhole at 2 a.m. to set an example, the seriousness about her injury. Appendicectomy for right uretary colon. There is no harm or nothing is lost if you do appendicectomy in a patient having right uretary stone which could not be identified or could not be confirmed. To remove normal appendix, mistakenly diagnosed as uretary colic is no crime. Laparotomy for appendectomy when the patient is having peritonitis due to perforated appendicitis, laparotomy must be done. The surgeon should not hesitate. Operation, write down on the whiteboard this having slate, pen or chalk, number of instruments, number of pairs, number of movers, everything must be noted down. Thyroid crisis. Thyroid crisis occurs only when the patient is euthyroid. Head injury patient, now a surgeon. Head injury patient, no head injury patient should be taken lightly. It should be always taken seriously. 60% burns cure.